toward a thriving women's and gender justice sector. I'm Hélène with the Canadian Women's Foundation, and I work on our Shock-Proofing Communities project, which you'll learn about more during our session today. Before we begin, I'd like to acknowledge that the work of the Canadian Women's Foundation and that of the programs we support take place on traditional First Nations, Métis, and Inuit territories. We're grateful for the opportunity to meet and work on this land. However, we recognize that land acknowledgements are not enough. We need to pursue truth, reconciliation, decolonization, and allyship in an ongoing effort to make right with all our relations. If you'd like to know more about the land you live on, you can visit nativeland.ca. We're putting the link in the chat box for you now. Now for some technical details. If you haven't already, please click the interpretation option at the bottom of your screen and select a language channel, English or French. We have interpreters working today to make sure everyone's words are understood. There's captioning available today in both French and English. Please visit the chat box for the links. Once you click on the link, a separate window will open for you to follow along with the script. Quelques détails techniques. Si vous ne l'avez pas encore fait, veuillez cliquer sur l'option Interprétation au bas de votre écran et sélectionner le français ou l'anglais selon votre choix. Nous avons de merveilleux interprètes qui travaillent fort pour que tout le monde soit bien compris et un service de sous-titrage en français et en anglais est aussi disponible. Donc, veuillez consulter les liens dans le chat pour y avoir accès. Une fois que vous aurez cliqué sur un lien, une nouvelle fenêtre s'ouvrira et affichera le sous-titrage. If you're having any tech issues, please feel free to pop a note in the chat box and we'll do our best to assist you. Our event today is divided into two parts. Panelist presentations from Anuradha Dugal, Robyn Hoogendam, and Campbell to set the context for a conversation about the need for a thriving women's and gender justice sector. And then breakout sessions facilitated by sector leaders that dig into what a thriving sector could really look like and how we can work towards achieving that vision. You should have received an email with the links to the breakout discussion groups you signed up for, but if not, don't worry. We'll post the session titles and links in the chat following our panelist presentations. If you have questions, please type them into the Q&A box during the event. We will monitor this box and pose your questions at the end of the session, doing our best to get to as many as possible. Also, please note that we're recording this session today. With that, I'd like to introduce our first panelist, Anuradha Dugal, Vice President of Community Initiatives and Policy at the Canadian Women's Foundation, to kick us off.
Thanks, Hélène. Thanks, everyone. It's wonderful to be with you today. I'm speaking to you from the traditional territories of the Kanien'kehá:ka people and in the area known as traditionally as Tiohtià:ke, also known as Montreal. And I'll be making my comments in English, but just for your information, I'm happy to respond to any questions you have in French. So my role is just to sort of set the scene a little bit of what was going on in, well, what has been going on for decades actually within Canada regarding our sector, whether that's gender justice sector, whether that's the broader women's sector, or sorry, as in all forms of all different kinds of gender justice rights, or whether that's the gender-based violence sector specifically. So as many of you know, and I'll just recap briefly some of the things, when the COVID-19 pandemic hit in 2020, it really exposed and exacerbated existing inequalities faced by women, gender diverse people, seniors, people living on low incomes, Black, Indigenous, and racialized communities, people with disabilities, people who identify as two-spirit LGBTQI, and also people who are migrants, who have emigrated or are refugees, and who perhaps are undocumented at the time, again, that the COVID pandemic hit. So because we knew that these factors were going on for so many different parts of the community, and Canadian Women's Foundation uses an intersectional lens to understand how gender justice can be achieved for multiple and diverse people. We wanted to explore the different effects the pandemic was happening on multiple communities in a series of reports that was called Resetting Normal. So another of the things that was highlighted by the way the pandemic affected feminist and gender justice organizations was the funding model that they were using, which I'll get into a little bit more, that they're in essence forced to use, and the systemic devaluing of any sector that is considered feminized, including obviously the women's and gender justice sector. So because of that systemic devaluing, there was already sort of a deficit, if you like, a created deficit, a vulnerability in the system that was created by the system towards organizations. And so when at the same time this sector is responding to significant increases in gender-based violence, I don't think you need the facts, but some organizations saw a 200% increase in the number of people calling. Some organizations actually saw a terrible silence because of social distancing, meaning that people couldn't actually reach out for help and had to adapt to that. Some organizations spoke about increases of numbers of people coming to shelters and that they had to turn away. And then some organizations said that they didn't have people coming to shelter because they were scared to do that. We also know that COVID-19 was used as another justification for violence and control by partners who were already abusive, in that they would try and control people's use of PPP, the people they're abusing, their use of personal protective equipment, their access to healthcare, their access to basic needs. So this is all happening. This is the backdrop in which we are seeing a spike in gender-based violence, a worsening in the housing crisis, increasing food insecurity, and at the same time, the pandemic made it very, very clear that the women and gender justice sector is essential, especially in times of crisis, especially because of the capacity organizations have to reach those who are most marginalized, who are furthest from services, and they're offering the kind of personalized, adapted, and very specific help that those communities need. So from our Resetting Normal report about what a thriving sector might look like, we analyzed some of the reasons why the existing organizations moving into the pandemic were experiencing high levels of stress and increased and difficult organizational realities, whether that was loss of volunteers, whether that was staff feeling that they had to split their time in 2 or 3 ways between work, home, healthcare needs, family needs because of perhaps children who are being schooled from home because of the shutdowns of schools, increased childcare needs, increased elder care needs because of what was happening in the long-term care homes. We know that many of those burdens fell on women within an understanding of the work that they were doing as being defunded, unfunded, considered less important, or at least considered to be not needing the same levels of funding as other sectors. So the types of workers, the types of pay inequalities, and the underfunding of the sector of the whole put those people working in the women and gender justice sector in an incredible amount of pressure, which comes, of course, from already patriarchal understandings of what care work is, which, again, I'm sure many of you have explored already, but I just want to set the stage. So that's the first part of it, that societal context. Next to that, we have a funding model, which is unpredictable and irregular, that is time consuming, where the burden of proving efficacy of proving that the money is spent in the appropriate way, accountability measures that are burdensome, different forms of funding that make for multiple reporting mechanisms and multiple kinds of application processes, put organizations that were in a need to try and push out more activity, more actually frontline services, while having to deal with a very high number of administrative services. And I would just say, I don't know if I'm happy to find the article and put the link in the chat in a minute. There have been recent articles that said that the model should be that actually 30% of an organization's budget should be dedicated to administration and ongoing support outside of direct programs, which I think is a very interesting number, considering what we know about things like the charitable ratio. So the idea that you have to prove that at least 70 or 75% of your resources are going directly to programs, and that often that number is expected to be as high as 80 and 85% as a way of proving that you're spending the money like you should be spending it. So I just want to highlight that. So within these existing inequalities and the case of how the sector is devalued, the pandemic increased this. Of course, we know that emergency funding flowed, and that was extremely important, that emergency funding came through and it was available with very, very low barrier options. And that is something that we need to consider going forward as to what it means to have a thriving sector. But there was increased isolation. There were different services or services that had to be modified. There were certain areas living in tech gaps or internet gaps where there's a sort of digital divide between the areas that could put everything online because of the types of access they had to technology and internet connection, and then those organizations that could not do that because of their location or their services that were available to them in their area. Not to mention an increased amount of trauma on staff themselves. And actually, we also heard that after some time, the kinds of trauma that women and gender diverse people seeking supports for gender-based violence experienced was much, much higher, much more severe, more acute, more ongoing because of the pandemic. So this also means increased need. So in these circumstances, the report we created outlined the way that the sector itself was experiencing a shock while experiencing the spike in gender-based violence. So coming from the pandemic and still being within it, one of the big takeaways is that we need to have something in place so that we can cushion those shocks. We need to have necessary tools to deal with surge capacity when spikes happen in gender-based violence. We need to have access to technology and to different resources so that we can adapt to changing, increasing, or different community needs when a crisis happens. And we need to be able to have a situation where the existing reality is not one of crisis, even before an additional crisis happens. So we want to make sure that the sector, what we are asking for and what we're demanding is that the sectors we are working in exist in normal times under a situation where they are able to thrive so that in a crisis, they can do well. So this means addressing long-standing gaps in services, including advocacy work, including the reach that our sector has, and including the funding that is available, while also being able to be funded based on mission and based on values. Those are two important parts rather than only being based on projects. So we conducted research throughout the time, and we're still continuing that, which includes, you can find these reports on our website. For example, there's some on what happened to shelters during the pandemic, what has been happening to sex assault centers. We have reports on queering, gender-based violence prevention and intervention work. And Robyn will outline in greater detail some of the impacts on sexual assault centers and shelters. We also want to know what it looks like to have a thriving sector, what funding models will be able to achieve that vision. And Karen will walk us through some of those in a little bit. So just before I hand on, I just want to reiterate, I know that many of us are very familiar with the problems and the gaps faced by this sector, and that what these often do is create decision-making that is competitive rather than collaborative, funding models that create a lot of tension and inconsistencies in the sector and in the services offered, which we would like to address, as well as a lack of autonomy, because we are all, as organizations that are funded by governments or corporations, we're often asked to shift focus or apply for a certain kind of project only, rather than actually focus on pursuing a mission. So those are the situation that we're currently in. And these are the kinds of systemic problems we want to resolve. And we can resolve those by starting with an articulation of a vision of what a thriving sector would look like, what we want to bring into being, what is possible. So I will just stop there. I don't know if there's any comments or questions that I need to respond to before I pass it on to our next speaker.
Thank you, Anu. We'll come back to questions at the end of the plenary session here, but thank you for setting out the context for us so clearly. Next, we'll hear from Robyn Hoogendam, Research Coordinator at Women's Shelters Canada, who will share her recent research on what the pandemic has meant for the violence against women shelter sector.
I'm just going to share my screen. Hello, everyone. I really want to thank the Canadian Women's Foundation for inviting me to this really important conversation. I'm excited to share the work that Women's Shelters Canada has been up to. As was said before, I'll be sharing work specifically on the women's shelter and transition house sector, but I think there's a lot of applicability to the broader gender justice field. So I'd like to begin just by acknowledging that the land on which I reside is the traditional unceded territory of the Algonquin and Anishinaabe people, and I'm grateful to have the opportunity to live and be on this beautiful territory. So I'm going to share a study called the Feminist Brain Drain Study that Canadian Women's Shelters has undertaken. This came about in response to hearing from our members that they were struggling with labor issues. We wanted to better understand the depth of the HR crisis in the shelter sector. We wanted to identify and understand some of the issues that are also contributing to this crisis. We were very wary that we could get caught up in all of the challenges and all of the negative, though. So we wanted to also identify some potential solutions and supports for organizations, while also developing an action plan to help our workforce address some of the challenges that they're experiencing. So to carry out this research, it was a mixed methods approach we used. This included a national survey. To do this, we partnered with the Victimology Research Center at Algonquin College, and they were undertaking a broader survey about victim services providers, and we took part in that and included pushing that out to our frontline and leadership in the shelter sector. We had 314 respondents from the shelter and transition houses. We also completed a series of focus groups. We had 6 of these over the summer. They were with frontline staff, with management, with former shelter workers, and also with the provincial and territorial associations. And that came out to 45 participants in total. In just a few weeks, we'll also be hosting a national symposium with shelter representatives from across the country. And from that, that's where we're hoping to develop our national plan to address labor issues. So I'm going to give a very brief overview of some of the challenges that have emerged in this study. So both the survey and the focus groups have highlighted the extent to which shelter workers are experiencing issues of burnout and high rates of turnover in organizations. When we asked participants of the survey about the statement, "I frequently think of quitting my job," we saw that 28% indicated that they strongly agreed or they agreed with this statement, which is a huge potential turnover for our sector. We also see that 40% often or very often feel worn out because of their role as a helper. So all of these can may be contributing to turnover. We also heard in the focus groups from both management and frontline staff about these challenges. We know that high turnover rates is contributing to understaffing in the sector, and in turn, more work then falls on remaining staff. Unfortunately, our sector and the broader gender justice sector can't compete with other employers. In our case, it's often hospitals and health institutions and government, and we're especially around areas like pay and benefits. So we're seeing staff leave for those positions and possibly even for more money and for possibly less stressful work. We heard over and over again that shelters are being referred to as a training ground, and people are leaving once they have the qualifications to move on to other roles. So in terms of this issue, it is not new and it's not caused by COVID, but we have seen the effects of COVID really exacerbate labor issues in our sector. So you can see here, we saw an increase in the workload. People reported an increased level of stress, and they also overall saw a decrease in their mental well-being related to COVID. Shelters in the last 2.5 years have seen the complexity of cases coming into the shelters. They've seen violence become much more severe. And all of this is combined with people traversing their own COVID journeys and their own COVID challenges. So we're really seeing how this has contributed to those issues of burnout and turnover. An area we don't talk about a lot, and it was a component of our survey, was violence and abuse and harassment that is experienced by workers in our sector, both by other staff and management, but also by our clients. We asked specifically about microaggressions, and you can see here that a high number of respondents of the survey indicated that they're experiencing microaggressions or they're witnessing these, including 50% of respondents having witnessed or experienced these based on race, and 25 to 30% experiencing them on all the other factors that we asked about. In the focus groups, we also heard about how abuse was experienced from both staff and clients. Well, in the centers or in the shelters, when harassment was experienced by other staff or even management, yes, toxic work environments were discussed, but many also mentioned that there were protocols in place to address these policies. So even if they weren't dealt with as timely as people would like, there were actually systems in place. By comparison, we found that discussions about harassment or abuse experienced from clients was a lot more challenging. We're talking about really vulnerable populations, and so there was a lot less discussion and a lot less ability to deal with these. So we've identified 5 key themes that have emerged from the focus groups and are backed up by the survey data. And I'm going to be very brief, but when these exist in a shelter, in an office, they're really contributing to a healthier workplace, and they have the ability to combat issues like burnout, or turnover. By comparison, when they're lacking, those are spaces where people are considering leaving, or they're dealing with the stresses of work. I'm also going to talk a little bit about how organizations are trying to foster these in their organizations. So the first of these is appreciation, support, and connection. We heard over and over again the value of feeling appreciated, of having coworkers and management that check in and debrief with individuals, and just how important that is. So we heard about things like just regular check-ins, informal social times, and those were all contributing to healthy work environments. The next theme is good communication and management. I don't think any of these will come as a surprise, but items like clear messaging and regular communication were appreciated by staff, particularly during the pandemic. Having strong management, having good communication really allowed people to have confidence in their leadership and the directions the organization was taking. Focus group participants in particular talked about wanting to have autonomy and independence in their work. They wanted to feel trusted. They wanted to be part of decision-making, and they didn't want to feel micromanaged. I think it'll go without saying, we heard about the role of compensations, benefits, and professional development on keeping people in these roles. So while organizations did speak about the ability to add salaries or benefits or top these up, there were a lot of organizations that said they were unable to take these actions. For those organizations that couldn't provide top-ups, they were looking at providing increased vacation days, sick and mental health days, and even adding wellness days to what employees were receiving. Lots of them were also trying to increase the amount of training they could offer to their staff. But we know this issue is really rooted in funding challenges, and we expect this to be a large piece coming out of the symposium and thinking about the action plan moving forward. The fourth theme is around self-care. And this is sort of the most common place that organizations are trying to make a difference for their employees. And so we heard about the development of staff-led wellness committees. Organizations are trying to provide both emotional and physical spaces for just taking breaks throughout the day, especially when people have dealt with difficult cases. And we also heard about an organization that talked about implementing Wellness Mondays, where staff actually had the Monday morning free from their typical client appointments to engage in their own self-care. There was a lot of organizations were working really hard to help their staff fill their cups so they could continue to serve clients in the way that would be really supportive. So the last theme is around workload, balance, and flexibility. And we heard flexibility over and over again. The workload in our sector is absolutely huge. It's grown more complex. Organizations are seeing an increase in mental health and addictions issues come into the centers, and just increased demands throughout the pandemic. So to counter this, organizations are doing small things, making sure that staff can take time away for daytime appointments or children's activities that they want to be there for, adjusting shifts or schedules to better accommodate what people are looking for in terms, especially, and we know there are challenges in working around inflexible work and wanting to be there for clients, but flexibility really could build a strong workplace and keep staff able to keep coming back each day. So given all of the challenges in this work, I wanted to end in a hopeful place. And so I wanted to share just a little bit about what we heard about vicarious resilience through the survey. So vicarious resilience is basically the opposite of vicarious trauma. It's the positive impact of repeated exposure to witnessing the coping skills, problem solving, the courage of the clients that we interact with every day. And that really can support the growth and development of the person doing the helping. So this was a 27-point scale, and I've just pulled a few of the results out of this and some examples of how this work that people are engaged in is having a positive impact on their lives. So you can see here that people feel more compassion for others. They're better able to remain present when hearing trauma narratives. They're becoming more resourceful as a result of this work. And they're more aware of their power and privilege, both in the work, but also in their daily lives as well. We haven't delved into this data very much, as this is all very preliminary, but this is a piece we're really excited to share and really excited to look at in more detail. So I want to thank you all for taking the time to listen today. This is a very tiny portion of all of the data we've collected, the learnings we're starting to pull together. And so please feel free to connect with me if you want to find out more about this. And I'm really looking forward to your questions. Thank you.
Thank you, Robyn, for sharing those findings, which provide really helpful data to back up what folks in the sector have been reporting since the pandemic began. Before we get to questions, finally, we will turn to Karen Campbell, Director of Community Initiatives and Policy at the Canadian Women's Foundation, who will speak to the working paper that you received prior to this event and which we developed to spark a conversation about what a thriving sector would look like.
Thanks very much, Hélène, and happy to be here with all of you today. Thank you, Anu and Robyn, for setting this up so well. My name is Karen Campbell, and I'm joining today from London, Ontario, on the traditional territories of the Anishinaabe, Haudenosaunee, Lenape, and Attawandaron peoples, and I'm grateful to have the privilege of living and working on this land. So today I'm going to talk to you about the thriving sector paper that we provided prior to the session today. It's okay if you haven't had a chance to read it yet. I'll be walking through the elements of that paper through my presentation today. I'd like to acknowledge two people before I get started. One is Manveer Bangu, who was the researcher who prepared this report for us, and to Anne Decter, who really led that on behalf of the foundation, and who is unfortunately unable to join today. She helped to prepare this presentation as well, so wanted to name those two people before I get started. So we initiated this report with a view to describing a vision of a thriving women's and gender justice sector, and to explore a path towards achieving it. And we've had many conversations about what's missing in the paper, what we still need to do to support the sector, what's not working well within the women's and gender justice sector. But in this report, we really wanted to flip the conversation and sketch out a vision for a thriving sector and steps that we can take to achieve it, with the intention of opening up a broader dialogue, which is what you're all part of here today. In this discussion, when we use the term women's and gender justice sector, we're talking about the full, dynamic, mission-driven sector of organizations, groups, and initiatives, ranging from larger multi-service organizations to women's shelters, sexual assault centers, settlement agencies, advocacy groups, research and policy institutes, and grassroots groups that are focused on community education, awareness, and engagement. So a large array of different kinds of organizations is what we have in mind. And while the sector itself was developed in response to inequality and injustice, the sector is also not immune to systemic barriers and equity issues. So at the same time as we're all contributing directly to well-being locally, regionally, and nationally, and sparking advances in gender justice, we're also doing that continual internal work of making sure that we are doing this in a good way. As we are all aware, the women's and gender justice sector plays a critical role supporting communities. And we've already heard from Anu and from Robyn how urgent that support became during the pandemic. So in terms of how we approached this paper, we did some information gathering that included a detailed literature review and interviews and a survey of various stakeholders in the women's and gender justice sector across Canada. So we talked to people working in policy, in research, folks who manage organizations, people providing direct services on the front lines as well. And the research really describes a vision of a thriving sector that is directly responsible for healthy, vibrant communities, and that's able to foster a healthy and vibrant country. And the path to this requires strengthening and adequately resourcing the sector in 4 key areas. So I'm going to name the 4 areas, and then I'll also describe those for you as well. So the 4 areas, number 1 is the dynamic diversity of the sector. Number 2 is looking at decent work in the sector that Robyn just spoke to, sufficient and sustained funding for the sector, and organizational autonomy. As one stakeholder in the research said, a thriving sector would be a place where women can be heard, where they can feel safe, where they can explore possibilities and dream about opportunities for what they want out of their lives and get support to achieve those goals for themselves. And we thought that was a really powerful quote to sum up, what a thriving sector would be for. So in terms of addressing the dynamic diversity of the sector, in our report, we described that requiring supporting the full breadth of services, initiatives, and groups in the sector, as well as the diversity of populations engaged in the sector and served by it. So a range of types of organizations, a range of people that would be embraced and respected, that diversity. Services and advocacy would go hand in hand. So the work of advocacy, research, and policy groups would be as valued as that of those providing direct service through shelters, multi-service agencies, and smaller grassroots organizations. One of our breakout sessions this afternoon, hosted by Jen Clayman, will be looking at that valuing of services and advocacy directly. Differences across the range of stakeholders would be bridged and embraced, and the intersectional and complex needs of women and gender diverse people would be appropriately addressed. So one stakeholder indicated that in a thriving sector, a plurality of groups with different mandates and serving different women, including ethnic and cultural communities, low income, marginalized workers, and seniors groups would all be accommodated. And in another breakout session this afternoon, Arzu from Platform will be talking about diversity and leadership. So that will be picking up that thread of our report. And another type of diversity, geographic diversity, would also be embraced in a thriving sector where support services would reach all populations equitably. So here we're talking mainly about organizations in rural, remote, and northern communities. In a thriving sector, they would be supported to access resources and infrastructure, and that they would be funded on an equity model, so replacing kind of a per capita funding approach, because we know that populations are much smaller in rural and remote areas and more dispersed. So Cheryl from Dragonfly Center will be speaking to that in the third breakout session that we have today as well. So that was the first characteristic, addressing that sort of dynamic diversity of the sector. The second piece is the decent work piece. Decent work requires ensuring that the workforce is adequately paid and well supported. So in a thriving sector, workers would be equitably paid in decent jobs with full-time permanent employment and benefits, including retirement plans. They would have well-being and mental health resources available to them that take into account vicarious trauma and burnout. I think the other important piece around decent work for us is that whatever funding model we have would need to include compensating people for the emotional labor that they do and a lot of the work that is currently unpaid. And recognizing that a lot of the unpaid labor in this sector is also done by marginalized, racialized folks who are representing the populations that are served. This is one of the most racialized and gendered employment sectors that we have, and so that work needs to be recognized. A stakeholder quoted in our paper says, any and every funding model really needs to pay attention to how we are paying women workers doing this work. They are usually racialized immigrant women who belong to the communities they are serving. So thirdly is that ever-present funding question. Sufficient and sustained funding would be flexible and focused on meeting community needs. So in a thriving sector, all types of organizations would have adequate, coordinated funding provided by multiple levels of government. This would be general support for them to be able to fulfill their missions. So stable operational funding, maybe something similar to the recent multi-year capacity building funding that the Department of Women and Gender Equality made available. The funding process itself would be equitable, accessible, and sustainable. And funding opportunities would center on the needs of the organizations and the groups and communities that they serve. So when you receive a request for proposals from a funder, that request would focus on meeting needs and not requiring the creation of a new program to meet a funder mandate. So in a thriving sector, that's the kind of funding we would be looking for. Yeah, one of the stakeholders quoted in our paper said, providing operational funding is key. So really being able to do their core work in a sustainable way. And the last characteristic of a thriving sector that our paper touched on is organizational autonomy. Organizational autonomy is essential to developing a collaborative, coordinated, and sustainable sector. In a healthy, thriving sector, organizations would have autonomy over their funding programs, over their funding, over their programs, over which populations they serve and how. Another stakeholder quote, funding has to be flexible. It should be spent as you need it. Those that know their communities the best are the organizations serving them. In a thriving sector, the capacity of organizations would be built. They would be built on this understanding that gender equality issues aren't solved in a single year on a single project cycle. Smaller organizations would have the support to develop fundraising and strategic plans and be recognized for their innovation. All stakeholders in the sector, including funders, organizations, grassroots groups, and governments, would work together in cross-sector collaboration. Networking to build capacity and sustainability and strengthen collaborations and partnerships would be welcomed and supported. And of course, women's and gender-specific organizations would be consulted and work in participatory ways. So in terms of a path forward, the path to thriving demands a focus on providing the sector with the means to ensure that organizations can remain mission-driven and that women and gender diverse people are supported based on their identified needs, and that the gender justice advances that we need would happen at a rapid pace. This is really urgent. And so the research suggests that a thriving sector has to include all of the things that I just described around the types of support needed to eliminate the structural barriers to thriving. This is a mission-driven sector, and that needs the means to achieve its mission. So the foundation will continue to develop this working paper following the event, and we do look forward to your contributions in questions, in the chat, and during our breakout sessions today. And I think I'll leave it there for now. Thank you.
Thank you, Karen, for sharing this research and really setting the stage for our breakout discussions. We're running a little short on time, so I think we'll do one audience question, and then we'll send you off to your breakout discussions. So we have a question here about what available services or programs can cushion the kinds of shocks that were mentioned throughout the presentations, though I think this question came right after Anu's presentation, so I will open it up to all the panelists. But again, yeah, we're asking, are there any services or programs that can cushion shocks?
I don't mind starting. I think, as you pointed out, Hélène, any one of us could say something about this. I think the most important starting point is that our sector is, or these sectors maybe, are recognized as being essential and are recognized as needing serious support. So not piecemeal, not project managed, not balanced by different budgets, how things can change, but that is, they are considered essential and ongoing. And also that it's understood, and this is something, in spite of recognizing that emergencies were happening in gender-based violence and providing emergency funding for that, provincial, territorial, and federal messaging from the leaders of any of those areas about the pandemic often missed a gender-based violence message, and also often missed an intersectional analysis. And so that is something that I would expect to see from territories, from provinces, and from the federal government going forward, that all their messages include those important points.
I can go ahead. I was jotting notes down. I was thinking of this question, and as soon as Anu spoke, I realized we were going to say the same thing. But I think, just to add to that, something we're hearing a lot from especially the leadership in our sector is they don't feel respected, and they don't feel like other organizations, governments, and funders, and even the organizations we have to work with, in our case, police, child welfare, they don't understand our expertise or don't recognize our expertise. And so I think some of the things, those 5 themes I pointed out that we're hearing, they map really well against what Karen and Anu both spoke about. The sector needs funding, the sector needs respect and appreciation. We need to have strong relationships with places like funders. And we need to think about the communication and management that's happening between organizations and funders. Because I think all of those really are, to some extent, while they're important in organizations, they're also a really strong root in how we can thrive and work with all the relationships that we need to manage.
And maybe I'll just briefly add to that, you know, in the many organizations that we've been speaking to, it seems as though the sort of consultations, you know, with folks involved in emergency management really came after the fact. Like, once the evidence was mounting that there was this shadow pandemic of gender-based violence occurring, and, you know, that was getting talked about, that's when folks were approached, and at that point they were really overstretched, and it was very difficult for them to contribute to those conversations, and really an unfair ask at that point. And so I think, Robyn, you're right, that recognition and respect for the life-saving work that these organizations are doing And not just in the gender-based violence sector, but in all parts of the women's and gender justice sector that are addressing the gendered impacts of this pandemic that come in all different kinds of forms, that they're not at the table in the early stages. They're called in afterwards, and that's problematic.
Thank you. Once again, I really want to express our deep appreciation to all three of you for all that you've shared this afternoon. And you've set us up very well for the discussion that will follow in the next session. So as you know, for the next part of our event, we're going to split up into small group discussions focused on different parts of a vision for a thriving sector. You will have to navigate to a different Zoom link to join your breakout session. This is because of the accessibility supports that folks require that are not available to us in typical Zoom breakout rooms. So the first breakout group will focus on redefining leadership in the women's and gender justice sector, and will be led and facilitated by Arzu Najibzadeh from Platform. Breakout room 2, or breakout group 2, will look at expanding the sector's reach to all regions, rural, remote, and northern, and that will be led by Cheryl Bujold at Dragonfly Center in Alberta. And the links are being added in the chat as I'm speaking. And finally, the last breakout group 3, it will look at the sector's capacity to value both service provision and advocacy. It's led by Jen Clayman from Stella, l'Ami de Mimi, and the Canadian Alliance for Sex Work Law Reform. And that link is in the chat now as well. So please take a minute now to copy the link to your breakout discussion group and save it in a separate note or document, or open it now, because the breakout discussion group links will disappear once we close this session. So make sure you grab them. If you don't manage to grab your link on time, please check your email. Everyone has received a message from us with the link to your breakout room included. We will give you a break now for a few minutes to allow you to stretch, reset, find your way over to your breakout room, and then we'll start the breakout conversations at 2:10 p.m. Eastern Time. Since we won't be joining together again in a plenary session, I'd like to close us out here by thanking all of our lovely panelists for sharing your knowledge with us today, to our incredible team of French, English, and ASL, LSQ interpreters and captioners. Thank you for helping us to make sure this event is accessible, is as accessible as possible. And thank you to Pamela Filion, Melissa Bagir-Kandi, Liz Fu, and the rest of my colleagues at the Foundation who are running everything you see today in the background. You're all amazing. Thank you to all who are participating today. We really look forward to picking up the conversation in the breakout rooms in a few minutes. So thank you.